Okay, so the numbers have kind of slowed down now, so we'll go ahead and get started and people can just continue to join as time moves forward. But thank you for joining us today. My name is Carrington Lott. I'm the program manager at Systems for Action. And if you're not familiar with Systems for Action, we're a national research program office of the Robert Wood Johnson Foundation, and we fund studies all across the United States that are looking at innovative mechanisms of aligning public health, social services, and medical care. So this is today you're going to be hearing from one of our projects that's funded at Washington University, the Brown School of Public Health. And this is their second or third presentation, I believe. We've been working with Melissa and Trish for a while here, but they will be talking about their project, PACT St. Louis Evaluation, Culture, Context, Community Participation. So we thank you so much for joining us today. And with that, I'm going to go ahead and let you know what's on the agenda. So we just have a really brief welcome for me, and then I'll hand it over to our panelists so they can tell you about their project and give you some updates about what they've learned along the way. And then for the last 10 to 15 minutes, we will reserve that time for questions and answers. However, if any questions come up along the way, feel free to enter those into the Q&A box at the bottom of your Zoom screen, and we'll make sure to address those at the end of today's session. And also one thing that's not mentioned in the agenda here, but I do want to mention that we have Yolanda West here, who will be giving commentary after Melissa and Trish go through their presentation. So we're really thankful for everyone joining today. With that, I'll give you just a really brief bio of Dr. Johnson-Reed. She's the chair of the Violence and Injury Prevention Concentration in the Master of Social Work program, and she supervises an interdisciplinary violence and injury certificate program. I will not read through this entire bio, but we will be sending out the slides after this. So if you're interested in reading the entire bios, you can do that at a later time. And then we also have Dr. Cole, who is focused on strengthening, implementing, and sustaining evidence-based interventions that improve the quality of care for vulnerable families. She's affiliated with 2 research centers at the Brown School, the Center for Mental Health Services Research and the Center for Injury and Violence Prevention. So with that, Trish, I'm going to stop sharing my screen so that you can share yours and get started on the presentation.
Okay, and I just need to start by saying we need to update those. Melissa is director of the Center for Innovation and Child Maltreatment.
Policy Research and Training.
Policy Research and Training, I'm sorry, the CICM, and I am co-director of the Community Education Core of that. So we do need to update those bios.
Thank you, Trish. Send those to me and I can update them before we send out the slides to everyone.
Oh, awesome.
That would be
okay.
Fantastic.
Great.
And let me go ahead and share my screen. Can you see that? Okay.
It's not in presentation mode yet, but there it is.
Okay, so and I want to thank Yolanda for being with us. Yolanda is program director of PACT-STL with the Vision for Children at Risk, and we're doing this work because of VCR and the work that they're doing. So I want to acknowledge that. So our Systems for Action grant is actually situated on top of an ACF funded project, the Parents and Children Together St. Louis, the PACT-STL. And so ACF funds the implementation of the PACT-STL strategies and some of the evaluation activities, and what RWJ what this grant has allowed us to do is build out a more comprehensive evaluation. So I do always want to acknowledge that, and also acknowledge that because we're sort of mapping onto the PACT-STL grant, that from our timeline, it is, we're reliant on the aims of this project are reliant on where we are in the aims for with PACT-STL, and there have been some delays on some of the activities, and so we'll talk about that as we go through as well. Okay, so just as a reminder, and if those of you who have been on each year, I apologize if there's any redundancy, but just a reminder. So PACT-STL has a prevention and early intervention focus. It is a multi-level intervention that is about how do we strengthen families, how do we prevent maltreatment, and promote healthy child development. It does leverage an existing child prevention network that has actually been in place within the St. Louis community in various formats for several decades. And so they serve as the collaborative, that provides sort of overarching support, guidance, feedback as we go along. And our goal is, how do we increase strategic collaboration among its member organizations? So we do have collaborative level goals here, and really looking at, and one of the things that we are focused on is that funding alignment, and how do you realign funding among a strategic collaboration in order to improve outcomes, to have more efficient and effective services. And PACT-STL is also looking to build the capacity to provide evidence-based interventions. They're implementing parent empowerment and public health strategies, and I'm going to go over those strategies very quickly here. There's parent cafes, vitality cafes, which are both very empowerment-based, community participatory. Parents themselves are trained as table leaders and help with the facilitation process, so are very, very engaged there. There is an evidence-based parenting program I'll talk about more in a minute, as well as family mentors, that if families have had, currently have, or have very recently had active engagement with the Child Protective Service case, or the public Child Protective Service system, that the parent mentors help them navigate this system. We do also have then at the systems level, there are organizations that are trained to host the vitality, as well as community cafes. So there's system level activities there. Providers are trained to facilitate evidence-based parenting programs. Organizations are trained in cultural competency. And then there is the assessment of current funding streams and alignment of fundings. And I will say that, and then of course, collaborative meetings, that everything that we're doing is about how do we center parent voice in all aspects of the project. Two of the ways, and these are only two of the ways that we're doing that, are through community cafes, as well as parent advisory councils, which I'll talk more about in a minute. And then the race equity lens goes across all of this. I will also say it's a multi-level intervention. So it's there's a multi-level implementation strategy. And so there's also a multi-level evaluation that maps onto this, where we're using at the collaborative level network analysis, group model building, observation, and then we have community cafes, we're focus groups, interviews, as well as administrative data that you're going to hear more about from Melissa. So it is the evaluation, it's participatory, there's multiple methods from multiple stakeholders. I do want to say around the race equity piece, that from our parents and providers, we have heard in as part of the evaluation process, as part of community cafes, that race inequity is a big challenge in our community that impacts access to services, that impacts outcomes of services. And so VCR has worked with the Race Forward Institute, and they have conducted a series of trainings with parents, providers, with VCR, with the evaluation team around building race equity in community. And then the next step of this is technical assistance. And so VCR, who is the Vision for Children at Risk, the parent agency, is receiving technical assistance. The evaluation team, we're in the process of planning and arranging that. So we will have our own technical assistance, as well as then the collaborative in and of itself. So there'll be these multiple facets. We'll have the opportunity, and through the technical assistance, we will be designing race equity plans, and then we'll be evaluating the implementation of those. And I will tell you, from the evaluation standpoint, one of our big questions is around how are we going to measure the success of this work? What are our objectives? We often talk about we're striving for race equity. Well, we want to know, what is that we are going to define, we're working to define in consultation with Race Forward. What will this look like? What will this look like for PACT-STL? What will this look like for our community? And then how will that be measured? And I want to be cognizant of time. So then, in terms of engaging parents, engaging community, I do want to start. I think that it's really important that we talk about lived experience a lot. And any time that I'm bringing this into presentations or papers or conversations, I think it's important, how are we defining it? Because it's defined very, very differently. And so for PACT-STL, lived experience is parents or caregivers with current or previous child protective services contact. This could be a report, in-home services, or having children removed from the home. So it could be that this happened recently, it happened a year ago, or it happened 15 years ago. So it is broad in that regard, but we do have a definition. So the ways in which we engage parents with lived experience are the community cafes, which I'm going to talk about. The Parent Advisory Council is also critical in this piece, and that is a leadership council that is comprised of parents, and that they provide feedback. They actually, for instance, I will say, so we had one plan around what the evidence-based parenting intervention was going to be, and that didn't work out. That was a different intervention. And so as we were looking at, or as VCR, we're looking at this. Okay, I participated in this. I'm the evaluator, but I do participate in a lot of these conversations. So, so let me just say. So I tend to say we. VCR is the implementer of PACT-STL. We are the evaluators. So it went back to the Parent Advisory Council. We brought them, or Yolanda and her team brought them different ideas, different possibilities. It went to the collaborative. It went before the collaborative multiple times before landing on, okay, we're going to bring incredible years in. And so it was a joint, there is joint decision making in which parents have the opportunity to share their opinions and their perspectives as well. So then we're also using traditional data collection methods, which, focus groups and surveys, which I'm not going to talk about here. I'm really going to focus on the community cafes as the model, or as the one strategy here. And so we talk in child welfare. And let me also say the collaborative while we're focused on the prevention of child maltreatment, the collaborative is a cross-sector collaborative that is comprised of member organizations from healthcare, from public health, from social service agencies, both public and private. So it is this cross-sector, cross-service sector collaboration with the goal, because the reality is child maltreatment is a huge public health problem. And we need, not one discipline or service sector can adequately address all of the needs around preventing and responding to maltreatment. So really need to bring together these groups. And I also want to say, I forgot when I was talking about the Parent Advisory Council, that there are representatives from the Parent Advisory Council that are also on the collaborative as well. So do want to make sure I point that out. So we've talked about the engagement of families with lived experience in child welfare reform for some time now. It's still not routinely used. What it should look like, what it's supposed to look like, what that means is there's still ongoing conversations, but it's not routinely used. And it's really important because sharing stories can both be therapeutic as well as an act of a form of empowerment for families who do often feel disenfranchised and discriminated against by the child welfare system, but I will also say by healthcare, by public health, by all of the different agencies that they're interacting with to address their complex issues. And so bringing their voice, elevating their voice is really important. And so VCR and PACT-STL use community cafes as a way to do this. It allows for community voice in the development and redesign CR in this project, really put that at the center. It is about bringing parent voice to the work that we're doing to prevent child maltreatment. And community cafes do empower community members to identify their unmet needs and work with them to develop solutions and action plans. So they are central to this work. So it's a participatory engagement strategy. It is based on the World Cafe model, and it is about engaging the community about questions that really are of interest to them. And so the Vision for Children at Risk, which should be capitalized there, I do apologize, has hosted several of those with caregivers with lived experience. And so with that, let me skip to this one. So using that, we have had the opportunity, and we have an in-press paper then that has looked at community cafes as a means to empower African-American voices in child welfare intervention research. And so just wanting to highlight that, the cafes are structured in a way that they're very intentionally structured. It's about constructive, authentic dialogue, wanting collective intelligence, wisdom to actually emerge through the sharing of experiences and of thoughts, everybody having the opportunity to share and to be listened to. And so it is really this organic self-organizing process that is centralized on a specific designated topic of relevance to the participants. It's the structure is that there are small group discussions in which there are certain questions that those groups then work together to answer. And then there's the harvesting where every table reports back. and then a process of coming to group consensus on potential next steps. And we'll say that PACT-STL had done some of these pre-COVID, and so we do have a subset that were pre-COVID and then have moved to COVID on this. And the next steps is really taking what has emerged from these into working groups and having parents and providers jointly work together to build solutions, to identify solutions, and then to implement them. Very solution focused. Can skip that. We did. There were over 100 participants in the cafes that we had done. We found that there is these are really have a lot of potential to engage community. We see them as a promising model around producing knowledge on how to improve and shape systems and services that are responsive to community needs, which is so important, because we, as providers and academics, we can say this is what we think the problem is, but what does the community think the problem is, and how can we then work together to identify that, and then that we are actually being responsive to their needs, not what we perceive their needs to be. So really excited about it, feel that it is a method that can help shift power dynamics, provide an opportunity for harm reduction and healing for those communities that are most affected by child welfare systems. The other piece I want to talk just a little bit about, and I want to make sure I'm leaving enough time for Melissa, is family mentors. So we have those multiple strategies, and in the family mentors is a little bit of a higher touch than some of the more family focused strategies, whereas parent cafes and vitality cafes that focus on risk and protective factors, that focus on parent quality of life, are very engagement. They're group based. There's a social network connectivity to it. It's very group based and not intended to address the more serious challenges that families may be facing. Whereas the Family Mentors program that is a part of that is actually for families that have recent or current hotlines that they have been involved in the Children's Division, and one of the things which is Missouri's Child Protective Service System. So we know that 2/3 of hotline calls in our area get diverted. So we have a differential response here, and so 2/3 of those calls get diverted to the family assessment track, which is a lower level of involvement than if it was the true investigation. But what we know is many families that go through this track who could benefit from connections to services often don't get them. It's voluntary, so they can choose not to participate. They don't know how, or they're unable to access services to which they're referred. They're so overwhelmed with so many other things. So what the Family Mentor is doing, it's really similar to health navigators, in that it's a parent with lived experience navigating the Children's Division, navigating our public child welfare system, and helping parents to understand the processes, accessing services, working with the parent to identify additional supports. So really, really an opportunity for families to actually get the services that they need early on versus waiting. Because one of the things that we know from work done with administrative data, some of Melissa's work, that that they often don't get any intervention for the first few, 1, 2, or 3 reports. It's after that there's been multiple reports and multiple assessments or investigations that the child either goes into foster care or the families get services. So the hope is to actually get family services earlier to prevent later re-involvement with the system. And then I'm going to turn it over now to Melissa, because administrative data is also in the data sharing are critical aspects to the evaluation that I will say that have been a little hampered, not a little, hampered by the delays in the starting of Incredible Years, the delays in the starting of the Family Mentor Program. So we're behind on our AIM-3, but I am going to turn it over to Melissa now to talk about where we are. And Melissa, just let me know as you when you need me to advance the screen.
So before I hit this slide, just want to say a brief word. There's actually a couple of layers of administrative data in this particular project. So there is the layer that I'm going to talk a little bit about today, which is actually part of our AIM-2, which is looking at sort of potential aggregate change. So the PACT St. Louis project was designed to target a set of zip codes in the St. Louis metropolitan region. And then, so we're looking at not only organizational connectivity and individual family and group family activities, but also at the end of the day, can we see any movement on some key child health and maltreatment indicators at the zip code level. And so I'll talk about that in a minute. And then secondly, we also have agreements from and are working on the process of getting administrative data from the partner agencies, where families that are engaged in these more individual level activities that Trish just presented on will be able to flow through these systems, hopefully in a much better coordinated and connected way, but we will be able then to receive the data from these agencies so we can get a better idea of the exact pathway from services, how long families stay engaged in services, what's the timing of the engagement, and how that relates to family well-being and child health outcomes, as well as recurrent contact with Children's Division. So that layer, that second layer, is really dependent on that rollout that Trish was talking about at the beginning of the presentation, which did get delayed due to COVID. So I'm not going to talk about that second layer. I'm going to just sort of chat a tiny bit about this aggregate level, because it's within the theme of our understanding sort of context and culture. So originally the design is we would get a set of zip codes, right, that we already have identified as the PACT St. Louis target zip codes. And we would then develop a comparison area from Kansas City, Missouri. For those of you who aren't super familiar with Missouri, we really only have 2 large urban regions. So there are other population centers, but in terms of really sort of what you think of as city and urban, really it's Kansas City and St. Louis that are the primary regions. So our idea was we would look for comparable zip codes in the Kansas City region. So some of the challenges, well, so we have data coming from the state health. So data coming from our hospital and healthcare system, and we also have data coming from our Children's Division on child maltreatment. So the Children's Division was anxious about even giving data at the zip code level as too sensitive. So we went back and rethought this process, and then took our zip codes and reformatted those zip codes into 3 groups. So in the target area, it's sort of the middle city only, county only, or this mid group of zip codes that's sort of our city county border. We're still awaiting approval for this for our child protection data, but we were able to receive the healthcare data based on this grouping of zip codes in St. Louis, and then trying to go find very similar zip codes in Kansas City. So the ideal, right, is to match zip codes as closely as possible, and our unique context in Missouri has made this rather a challenge. So Trish, you can move to the next slide for me. So few zip codes in the comparison metropolitan region had as low a median household income as our target zip codes in St. Louis. So right away, there was a bit of a struggle to find zip codes that were similar in terms of family aggregate level, zip code level poverty, which led to there being a different number of zip codes in our comparison group than our target areas. Also, St. Louis has a long history of segregated housing by income and race. So if you look at the PACT St. Louis zip codes, our group one, which was our city concentrated group, was 87% Black. That's according to census designations. Okay, the most segregated group in the comparison area was 70%. So we not only saw some differences in terms of more extreme poverty levels at the aggregate level in St. Louis, but also very different racial compositions. The reality is that in Kansas City, there are no zip codes that are as segregated by race, ethnicity as there are in St. Louis. The other difference in Kansas City is that in recent years, in those areas with the lower median household incomes, there's also been an increase in Hispanic Latinx family populations, which have not reached the same level in the zip codes that are targeted in St. Louis. So the other issue is that we also have a third ethnic racial group in Kansas City that we simply don't have comparable levels of in the St. Louis region. Okay, next zip code or slide, sorry. So here's just a summary of a couple of the indicators. We just got the data, and I just wanted to give you some examples of how this actually plays out. On my left in the slide, I see target region, and on the right, you see comparisons, and you will notice that in the target region for our Black families, the rates of premature birth and low birth weight are not only different within the target region by race and ethnicity, but they're quite different in the target region at baseline compared to our comparison regions. So in other words, when we tried to find the most comparable zip codes by poverty and race ethnicity in the Kansas City region, it looks very much like the population of Black households there are having different experiences in terms of their maternal and infant care than they are in the St. Louis region. So you can actually see the little asterisk there is that there is a significant baseline difference between the rate per 1,000 of premature births and low birth weights for Black families in our target region as compared to Black families in the comparison area. Okay. So, thinking about this, while generalizability and comparison is always top of mind when we're trying to understand our program outcomes, we also have to understand that sometimes there are contexts that are so unique that it is very, very difficult to think of matching and comparison in the same way. I didn't have time to go through this, but for any of you who are interested in the sort of history of this. This is just kind of a nice overview, non-research article that talks about sort of the unique context of segregation by race in St. Louis. So we will be looking at these data again after implementation, and we really look forward to your questions. And most of all, I just want to thank Yolanda for being willing to come and be a discussant for us today as the project director of PACT St. Louis, and looking forward to her thoughts.
Thank you, Trish. Thank you, Melissa, so much for including me on today. They did a great job at explaining the project and the different aspects of the project that we're working on. I'm just going to talk just a little bit about our parents, who we refer to as parent partners. We do not refer to them as clients, because we see it was one thing that was on one of Trish's slides that stated centering the parent voice in all aspects of the project. And that's what I feel like is just so special about this particular project. I come from 20 years of children's division, so I know the other side of it also. And just to be here and see the different aspects of how the parents are involved in every level of decision making. And literally they really are. We do it through 3 core components. We do it through engagement, empowerment, and then education. And Trish talked a lot about it. Engagement are the parent cafes, the vitality cafes, community cafes. They're very active in the Parent Advisory Council, where they help us make decisions about what we're going to talk about in the parent cafes, what we're going to talk about in the community cafes. And then they take the voices, 5 of them, take the voices of those families to our collaborative, who includes maybe over, would you say, at least 20 local agencies, including Children's Division, including Family Court. They take those ideas and help make decisions that help the project continue on, like the Incredible Years and different other things that we had to make decisions about. They're involved in our race equity training. They had their own training to teach them how to tell their stories and how do you deal with systems that have some inequities that affect your families. They were very active in that, and we had over 20 families represented there. We're looking at also doing another one with them. It helped to empower them, help with them to know how to transform culture, how to transform policies, and how to effectively represent your family and get the needs and that your family, the actual needs that your family has, how to be able to say that to a representative that comes into your home. And then they also involved in evaluation piece. We do share data with them. And sometimes Trish or is Karen usually comes and has a presentation to them to just explain where we are in the project, to find out what their needs are also. And the last thing we talked about, education. That's the Incredible Years that we have coming up. There was a delay, but now we are going to be able to be trained and then offer it to our parents and other parents within the community. And then one other thing our Parent Advisory Council mentioned is that they want to do an education series. You know, they know that through education, then you're able to empower and move on and do other things in your life and be able to take care of your families. So they want to be educated on entrepreneurship, how to financial things, how you invest, how you budget, how do I keep my family from always being underwater? They want that education. So we're going to be helping them, which they're going to lead it, this education series. And we're going to try to do at least a class once a month that the community can attend. And the last thing I mentioned was empowerment, which is the family mentoring program, which there was a delay, but now we're up and running. We're accepting referrals for families who have involvement with Children's Division. We're going to help them navigate those systems, help bridge those, be a bridge actually between Children's Division and the family to help them get the needs that they need. Not necessarily what everyone else feels like they need, but help them get what their family actually needs to be successful within their communities. I think that's the most of it.
Thank you so much, Yolanda. I appreciate that.
Thank you, Yolanda, and thank you, Melissa and Trish, for presenting some updates on your project. I do see that we have a lot of questions coming in, and there are a few in the Q&A, but there was one that came in through chat, and I just wanted to address that and see if there were any follow-up questions, because it was about the ethnicity breakdown of the families in the study. And I think that came in, Melissa, before you presented that slide. So if that person who had that question has any follow-up questions, please put it in the chat or add it to the Q&A. And then with that, let's move into our Q&A, since we have about 20 minutes left and we have 9 questions and maybe some more coming in if anybody can think of any others. There's a question here about admin data, and I know you touched on this. I think this question came in before you talked about it, but I'm curious if you want to say anything else about the admin data that you had. Their question was around whether your data is agency specific or if it's from the state.
And the answer is both. So we have state health data, and we have state we will have state level data from Children's Division at the aggregate level, but at the individual level. So as families start these individual processes, we will have data from the agencies that are serving the individual families. So we'll be tracking that at an entirely different level. So the answer is both.
Great, thank you for clarifying that. So our next question here is from OSU Brown School alum, which is exciting. It seems like there are a number of organizations and stakeholders involved in this program. How do you identify the organizations to participate, as well as motivate and encourage those organizations to dedicate the capacities to such an expansive project?
So Yolanda, I'll give this a try, and then you can jump in if I miss anything or misspeak in any way. So one of the benefits is that early on, and I worked with Scenario Suleiman, who is the executive director of the Vision for Children of Risk, in writing the proposal and writing the grant, and she was actually able to work with the St. Louis Child Abuse and Neglect Network. I knew there was one more N in there. In order, and they agreed to move into this oversight role. So instead of recreating another collaborative, because in St. Louis there's a lot of collaboratives, we were able to leverage an existing collaborative that has worked together. And I will say in various capacities over the years, they've taken on some different shapes throughout the years. The one thing though, the additional piece, so that's the starting point. There is an effort, as we have identified, as other organizations have been identified, that should be part of the collaborative. There's opportunities for invitations to bring them in as well. And I will say, in our network analysis, because we didn't want to limit it only to those organizations that are represented on the collaborative, we actually, and I believe I've presented the findings of the network analysis to this group before, because we did that in our first year, that because there are central players in child and family services that aren't necessarily represented on the collaborative, and identifying and recognizing those does provide opportunity. Can we invite you in? Would you like to have a greater role? So evaluation is allowing us to do that. Yolanda, is there anything you'd like to add?
I think just to it mentions about motivating and encouraging the
That's right.
organizations. As she mentioned, St. Louis CAN is what it is called. Kind of like our advisory board who started. They were already really connected with a lot of the child welfare organizations within the community through an education that they give, educational opportunity they give quarterly. And so a lot of those organizations wanted to be a part of St. Louis CAN so they can get the training piece for their staff. So that's one way that we have kept other organizations engaged, is because that has been offered throughout, this grant. There is still offered, and they don't even have to pay for it. It's free of charge now. So that's a way that we've kept people motivated, and also by offering incredible years training to them, and by offering parent cafe trainings to them. That is also an opportunity for them to help out the families that they work with and educate their staff free of charge. So they have continued to join with us in this effort to help our families that are dealing with Children's Division.
Great. Thank you both for addressing that question. I think that's a great segue into this next question, which is about how about recruitment. So how do you recruit parents to the council, and are they paid for participating in the council? And if so, is the funding for paying them coming from a sustainable source?
You want me to start off?
You can start off on that. Yeah.
Okay. So for recruitment, it was mentioned that we have family engagement specialists who work with our families. And what's special about our program is that they have lived experience. So they're able to have connections that, myself as a professional wouldn't have. So they do a lot of the recruiting of the parents is word of mouth. Parents can nominate themselves. A lot of times we see families that are participating in our parent cafes. They're the ones that become more involved, and then they're the ones who are on our actual council. And we actually have parents on our council who now have their own nonprofit organizations. So a lot of it is mostly, like a lot of things, word of mouth. And the piece about them being paid, they do receive a stipend through a gift card for participating.
Yolanda, and with the gift card, because that is really important. And I think the piece around sustainability is actually a great question. And once the funding goes away, how is that sustained?
Yeah.
And I don't know that there's a good answer for that, or do you?
I don't know. Right now, we're doing it, of course, because of our grants. There's just a piece that's budgeted into our funding. And we just continue to seek out different funding sources. And that's how we're able to sustain this. And you have on there also same for family mentors. Family mentors are actual employees of the agency. So as long as right now, it does end in 2024, but we're always looking for different avenues and different ways to keep the funding and keep the work going. So hopefully we won't have to worry about that.
And I will say that that's what makes things like the RWJ grant so important, because the implementation grant really couldn't have allowed us to do the depth of understanding of all these different outcomes of all these different activities at these different levels. And it's that kind of information that Yolanda and VCR are going to be able to have to go to other funders for sustainability to say, look at what is happening, look at what's going on. And without that, I think it's a hard ask.
Mm-hmm.
Thank you. Yeah, and those questions about sustainability always come up with these grant funded projects. So thank you for addressing that, and thanks for mentioning that, Melissa. So our next question here is about, how is your program navigating CPS claims for transgender parents or children? Is that something that you've addressed in this project?
That is a great question. Yolanda?
I think we haven't had to to encounter a situation yet, but I think through our race equity training that we will be definitely prepared if we do have any situations where there's transgender parents or children. And then CPS, a lot of people call it the Child Protection System, and in Missouri it's called Children's Division. But it's just that we haven't had to navigate a situation yet. But race equity, we definitely are going to be addressing that in our race equity work.
Thank you. I know you talked about these different models quite a bit, but I'm wondering if there's anything else you want to elaborate on about the World Cafe model, since someone had a specific question about it.
So yeah, in the World Cafe model is and yeah, okay, sorry. The World Cafe model is actually a model for bringing together communities in shared decision making, and it is actually a model. I mean, we certainly, I will say, you know, when the Brown School underwent their strategic plan, this is the model that we actually used in coming together, answering questions in small groups, really being thoughtful, and then harvesting those out into larger groups, and then working to prioritize them. So then you have multiple ideas that are generated, and so then as a group there is this prioritization of those different ideas and strategies. And so the community cafes are just a variant of the World Cafe model, in which it's bringing together community in order to address issues that are pertinent to the community.
Great. Thank you so much for explaining that. There is a question that came in the chat about the research for cafe models. Is there something that we could share in some follow-up communication about this model?
Trish, with the worldcafe.com, I could put that in the
Yeah,
chat. I mean,
absolutely, that would help. And then we do have a paper that is in press that we can. I'm hesitant to share it before it is actually published, but as soon as it's published, I can share it.
Yeah, and we can.
So what I put in the chat is not our research; it's the World Cafe model that Trish was talking about. But there's a bunch of papers and stuff on their website.
And for those that are interested in that, you can feel free to reach out to me, and because we have tons of resources about the model. I actually have, will say I have a doctoral student that is going to go in depth in studying this model as a means to empower African American communities, and so would love to talk to somebody more about it. But it is really we've had a really positive experience with it.
Thank you. And we'll share these in our follow-up email communication. And Trish, when you're comfortable sharing your research paper, when it is published, we can
as soon as it's published, and it should be, they told us fall, so it should be out, and sadly fall is going to be here before we know it. So that'll be soon. But if anybody wants to reach out to me directly, that's fine too.
Great. Okay, so our next question here, and we have about 6 minutes left, so I don't think we'll have time to get to all the questions, but what I can do is download all the questions that were unanswered and get those to the presenters here today, and we can follow up with you offline. So our next question, do you see evidence of child abuse being exacerbated upon the onset of the pandemic? If so, were there unique features of the ways child abuse manifested?
Trish, do you want me to take us?
Go ahead. Yeah.
So this is not going to be project specific, but because I'm a part of the conversation about this, the short answer is we don't know a lot yet. There are some indicators in studies of child hospitalization that the number of pediatric visits to ERs, for example, went down, but the proportion that are due to maltreatment remained the same or went up. Obviously the CPS reports, everybody knows that those went down. They didn't actually go down as much as some of the news. So they went down in various ways, right? Depending on how shut down your area was. It looks like in the newest national data, it was very, very specific to reports coming in from teachers and educators and for kids who are in the elementary school age range. So most of the other ages were actually flat. So in terms of like knowing, we know that stressors in various surveys that were done of families went up. We know that the economy is stressed right now. Those are certainly risk factors, but whether or not that is playing out in something very, very different or unique is I think still kind of to be determined. And Trish, you
Yeah,
feel free to add.
I echo that. Yeah, I agree with that.
Thank you. So I'm going to skip down here a little bit out of order and ask a question from Amy, which says, can you speak a bit more directly to how PACT St. Louis initiative braids together funding streams for multiple sectors to assist families, and any challenges that you've encountered in doing this braiding of your funding?
It's just been a challenge. Let me just say that. So and I will say in the work that we've done with the collaborative, specifically the group model building exercises that we did a series of workshops with the collaborative that were really looking at drivers within the system, both barriers and leverage points, and for collaboration, and certainly funding came out as a huge issue. And the reality is, I think that, they are competing for the same dollars. They are competing for the same populations to serve. So there's a lot of competitiveness. Certainly one of the things that came out is really in differential benefits, that you have the smaller, less funded organizations that are participating and highly involved in the collaborations, while at the same time you have the larger, better funded organizations that tend to benefit more, even though everybody's putting in the same effort. So those pieces came out. I will say one of the big challenges around funding is when we wrote the grant, it was the Family First federal policy, which is a policy that put in place mechanisms to use federal funding in ways that they had not previously been able to use, and in specifically around services for these lower risk families versus only more funding for foster care. It was taking, how do we divert some funding for this prevention end, and so the implementation, the Family First implementation team is a key partner, and was a partner on the grant. Our region's Family First implementation plan hasn't moved along as quickly as those plans in some other states and regions. Yolanda, would you like to say anything else about the Family First implementation team?
No, not that you haven't already covered.
Okay. So that has been a challenge because we certainly had planned on the ability to use that, and we haven't given up. We haven't given up. So we will keep plugging away at that. But that has been a challenge, and it's also interesting because two really tough issues emerged from the work we've done with the collaborative and the work we've done with parents. The funding and the race equity work, and there was, thankfully, we got more traction. We were able to get traction with the race equity work, but there's still work to be done to get to develop that traction around funding. But haven't given up. We're still working on it.
Ending on a positive note, and I think I saved the most challenging question for last, so thank you for addressing that. And we are about 1 minute over time, so I'm going to go ahead and close us out here. And Trish and Melissa and Yolanda, I will make sure to get you these questions we didn't have time to answer, and we can follow up with the folks that asked those offline. And I want to thank everyone for joining today. I will be emailing out the recording from today's session, as well as a PDF of the slides and any resources that were mentioned during today's session. And this is an ongoing research and progress webinar series, and this is an ongoing project. So this team will present again in the future so that you can continue to follow along and learn right along with them. And Trish, do you have something to say?
I just wanted to say, I did just put in chat to everyone my, because I said, contact me if you have questions about the community cafe. So I put my chat in there. I put my email in there.
Great. Thank you so much. And with that, I hope everyone has a wonderful rest of their day, and we look forward to seeing you at a future Research and Progress webinar. Take care.
All right, great. Thanks.